So if we're going to have an honest conversation about women's health, every woman needs to understand the hormone piece of this equation, because hormones at the end of the day are influencing every other aspect of their health.
Okay, Dr. Taz, you're here with me here at Well People after a day of patients.
Yes.
We've both been seeing patients doing integrative care. You have a book out called The Hormone Shift.
Yes.
And I think that qualifies you to talk about all the different things that can go wrong with the hormones in women. Specifically, I want to talk about women with PCOS, hypothalamic amenorrhea, and perimenopause.
Ooh, that's loaded.
It's very loaded. It's across the board, covers everything. But let's talk about it in the context of they're not having a regular period and they want to get pregnant. Where do you start with somebody who's not having a period?
Well, this is, what I do day in and day out. And I meet so many young women with PCOS and who have amenorrhea. And a lot of times we're trying to get to the root of where that's coming from. I think that we see so many different patterns, and many of the patterns are very patient dependent. But some of the biggest ones are poor digestive health, like really not having a healthy gut and a healthy and good gut flora to balance hormones effectively, along with having, and they're sort of connected, but along with having an element of insulin resistance. Those are two things that I see over and over again. But I would almost say, with all the things you mentioned, the hypothalamic amenorrhea, the PCOS, the perimenopause, the root is sometimes the liver. And if the liver is overburdened, right, or not able to do the work it's supposed to do, that's where you start to see all these other things fall off. And depending on the patient and their genetics, right, and their lifestyle, it's going to express itself in many of these different ways. So I would say those are the most common things I see, but then a lot of that is triggered by stress and our environment and our toxic load and how that entire hormone soup works together to show up as many of the things you mentioned.
Right. Well, our mutual background is acupuncture and Chinese medicine. And you said the liver, which means something to me, but it's different for integrative medicine. Can we inform the listener, what would the liver look like when there's something wrong with respect to hormones? How does it present?
And, it's hard for me because I am a trained acupuncturist as well. So when I say liver, I'm probably thinking like you, where I'm thinking about a system, not just a singular organ, an energy channel, right, that's getting blocked, where things aren't moving. But if we move it to more of the functional medicine lens or the integrative medicine lens, what we're talking about really is the ability of the body to detoxify, right, to really move things through. We know from science that there are two major detox pathways. There's phase 1 and phase 2 detoxification, and they're both highly dependent on the ability of the liver to do its job. And when it can't do its job, all the input from the environment, our Wi-Fi, our cell phones, our food, our stress, all those different things, we can't metabolize effectively and correctly. So we start to store and hold on to things like dirty hormones or hormone metabolites that work against us.
And when that happens, we see it in the I was going to say in the report card, but I mean the menstrual period.
I like that.
Right,
exactly.
And we see either a period's delayed or there's clumping and clotting, pain.
Definitely, yeah.
Irregular cycles, infertility.
All of it. I think all the things you deal with, I refer to acupuncture all the time because we see so many women in those patterns, right? We call it in Chinese medicine, liver stasis, right? Or liver yin deficiency. So in these very stagnant patterns that for me, the medical doctor, is really translating into the inability to detox, the inability to move things through, and the liver's getting sluggish and more sluggish over time. So absolutely. And what it looks like on a patient, so many patients will come in, I don't know if you've experienced this or not, but many patients will come in and be like, but my liver enzymes are fine. What are you talking about that my liver's bad? But what we're really talking about is the ability of your liver to do its job. And if it can't do its job, we're not waiting for liver enzymes to go awry, right? We're actually thinking more proactively and saying that this is not happening. We need to look at how the hormones are metabolized. So if you have, for example, high estrone or high DHT or high androgens, those are dirty hormones, really the result of which is the liver not able to do its job.
Mm-hmm. And the liver detox pathway is through the intestines?
It's through not just the intestines, it's a system, right? So the gut is a big one, and there's a gut microbiome, and those bacteria are very responsible for helping to conjugate and move estrogen and other hormones through. So yes, it is through the intestines, but we also need a healthy gallbladder. You also need bile, and you need to package up and process fat effectively for the hormones to be used accurately as well. So that's another really important piece of the detox puzzle too.
And those fats are converted into the hormones that the women need to have their cycle be regular, right?
Exactly, right. And so, I got into trouble in the 80s because I was so focused on being fat-free, along with stress and all the other things, that go into choosing a medical career. But again, I think a lot of it could have been circumvented if I was following a healthy diet, if I was paying attention to my stress levels and cortisol, and actually had a plan to manage a lot of that stuff.
Mm-hmm. But unfortunately, we were kind of told to follow that non-fat, highly processed.
Right. That was healthier because it was low calorie, right? So fewer calories were better. Mm-hmm. And we now know today that that's just simply not true.
Right. We need to go back to traditions like eating eggs to make eggs, or
eating eggs to make eggs.
And something I tell my patients because they are so worried about cholesterol, and that goes back to that generation and those foods. The eggs got a bad rap for real.
Eggs did get a bad rap. I feel like they are a superfood. They have choline, they have inositol, they have so many really incredible, lots of B vitamins, a lot of the great fats. So they really are a food that can help us on this journey of hormone balancing.
Right. So I got to know, what was the motivation to write The Hormone Shift?
So, I have been in practice now for about 15 years, and I see a lot of patients. A lot of them are women. And it struck me that their story was still so similar to my story, which was over 20 years ago, where there's usually a constellation of symptoms that are very vague. And they send us first into denial and then into trying to get answers. And in that journey of trying to get answers, most women continue to be categorically dismissed or be told that, hey, you've got anxiety, you've got depression, you've got, whatever it is out there. And, as I'm listening to women and women coming into our practice, and we're showing them this different way and this different approach, and we also show them the importance of testing hormones and tracking and trending your hormone patterns, it just felt like every time I was saying it, it was brand new information to the woman sitting in front of me, regardless of the age, right? Whether it was a young woman in her early 20s, or it was a teenager, or it was somebody in menopause or perimenopause. And so I think that I really recognize that if we're going to have an honest conversation about women's health, and we really want to talk about, gaslighting in women's health and how to make women advocates for their own health, every woman needs to understand the hormone piece of this equation, because hormones at the end of the day are influencing every other aspect of their health, right? So in my case too, I was having so many weird symptoms, gaining weight, rashes, foggy, not able to focus, acne, hair loss, all this stuff. And everybody would treat maybe an individual symptom and suggest a medication for each of those symptoms, or give me a blanket diagnosis of anxiety or depression. But nobody was able to connect the dots and put it all together. And unfortunately, when it comes to women's health, and honestly health in general, if we are not spending the time and energy understanding how things are interrelated, then we're really band-aiding a lot of different symptoms. And so I continue to see in practice, we've been in practice for 15 years at Center Spring MD. We have a team of almost 12 providers. I think we've had 40,000 patients walk through our doors. And unfortunately, really that hormone message was still not out there. Now, in the last year or so, as many of us are out there talking about this over and over again, the book is, becoming popular, it's being picked up, that type of thing. I think more women are aware of it. But it's still been a blank space that needed attention, but attention really stressed on interconnection and how hormones are built decade by decade by decade. They're not just something that happens to you and you suddenly show up in perimenopause and menopause and there's nothing you can do about it.
Right. It is that flow. Remember in Chinese medicine, it's like the 7-year cycle.
Yes. Yeah. So I would love for everyone to understand how that 7-year cycle works, because I know in Chinese and I think that's where I might have originally gotten this sort of decade by decade idea, because in Chinese medicine, they talk about hormone shifts, right? They talk about it in 7-year intervals, and we don't talk about it that way in Western medicine.
We try not to talk about it at
all. True. Right. It's not even on the table.
Right.
And it's still not on the table. Women are still told we can't check your hormones. There's no point checking your hormones.
Let's talk about that, because the hormones fluctuate all through the day.
Right.
And every day of the cycle. So how frequently do you check your patient's hormones? And I guess it depends on the goal and what you're looking for. But can you give us an idea and explain why, or maybe backing up and you explain how you're working differently since you started as an acupuncturist, I think, and now what you're doing is so unique and innovative and progressive. Please tell us about
the journey.
What you're doing.
So, I started as a traditional emergency room physician, right? So it was very much about procedures and, quick fixes and, all of that other stuff. Keeping people alive, not necessarily keeping them well. But, that's a very short-lived journey. After you do a certain number of procedures, ultimately at the end of the day, most of us that go into medicine want the relationship, right? We're motivated by someone getting better, and we want to be able to see that on a consistent basis. And so, as I'm working in the ER, my own health is getting impacted for sure. And I really, back in those days, right, we didn't have as many resources as we have today, and we didn't even have the medical or the educational training that we have today if you choose to do it outside of the traditional path. So when I was having my own health issues, it really was up to me to try to figure it out. So that's how I found Chinese medicine, Ayurvedic medicine, nutrition, this whole world that we weren't educated on when I was in medical school. And so what happened is it's been a journey of innovation, right? In my earliest patients, it would take me, probably 4 hours to do a treatment plan, because I was trying to figure out okay, you've got this, my regular education said X, but now I've got this Chinese medicine education and this Ayurvedic medicine education. What does it say? And it took a long time to master the ability to merge the two worlds together. And I didn't even know initially that I was merging the two worlds together. It wasn't a very conscious process, right? It was more like, let's just get answers for this person sitting in front of me.
Right.
And so as I do that over and over and over again, patient after patient, I go from, 3 patients a day to 4 patients a day to 8 to 12 to 1 day a week to 5 days, all this other stuff. As the volume of what I'm seeing is increasing, this now becomes a methodology, right, of merging Eastern and Western medicine together. And I remember so clearly, at some point, you probably experienced this too, you kind of hear yourself saying the same things in certain situations, right? It took me a while to realize that every time I'm saying this particular phrase, when I find this particular lab finding, I'm doing it over and over again. And I remember one day I was sitting in the exam room and I was talking to a patient and I was trying to explain to the patient, well, here's your Ayurvedic type. Here's your Chinese medicine type. This is what your labs say. This is what your hormones say. And I literally, it's like one of those downloads you get. I could literally see it on the wall. I'm like, oh my God, there are 5 key types. They're 5 main types. There are 5 main patterns. And if everybody was able to match themselves to one of these 5 key patterns, what an incredible roadmap that you could equip people with so they could at least start their journey, right? Because even with 5 patterns, people aren't, necessarily relegated to one of those. And so that was the birth of my book, The Superwoman RX, back in 2017. Which really tried to help women understand where they fell in this methodology that merged Eastern and Western medicine together. And so as I continue to practice, we train our medical providers into thinking this way, into thinking about how we can use Eastern medicine for diagnoses and how we can step into the toolbox and recommend things like acupuncture or even Chinese herbs or cupping or nutritional suggestions as well, the whole time looking at lab work and data and watching it shift and change. And it's been incredibly gratifying work because we're able to sort of move between, all right, you'll do better with X, Y, and Z, but you actually need a prescription and a medication. So we need to reach over here. And so it just continues to evolve. And it's now at the point where we have protocols for everything and we have a method and a way of practicing. But in the beginning, it didn't look like that. In the beginning, it was, how do I explain this to people? And do I even really know what I'm doing?
Yeah, it's the roots of integrative medicine.
Right.
And so that was something I wanted to talk to you about. There's so many different ways of integrating, right? I had a similar thing happen to me as a download with the seed program. It's saying the same thing at the same time of the month and writing suggestions for food or mantras and things. It is very helpful to the patients when they team up with a practitioner that can make sense of all of the different pieces of the puzzle.
Very much so. I mean, I think that's what we hear over and over again. Like we finally have someone that can connect the dots, right? And not sort of isolate and say, do this and then do this and then do this. And I think that's the art of what we both do.
Right. Let me throw a different type of case at you. I have a patient who is 22 years old. She's not trying to have a baby, but she isn't starting her period. And she had a period originally until about age 20. And for the past 2 years, she has not been able to menstruate. And her thyroid is fine. She's done the seed program. And I've put her onto herbs. We've done acupuncture. I've changed things up a couple of times. So where would you jump in with integrative medicine and hormone shift and all that you know?
Definitely. So the first thing a lot of times that I'm noticing when patients walk in the room and they've had sort of that journey is I want to do a very detailed hormone evaluation. So I will look at the data. We'll look at all the different androgens, all the different insulin markers. We'll look at derivatives of estrogen and progesterone and really try to understand what that hormone pathway looks like. What we often find in some of these cases is that these are patients that are insulin resistant. And if they've already done your program, tried herbs, tried acupuncture, then we may need to move on to managing something like insulin resistance with a medication. So this might be somebody who would benefit, for example, from metformin. The other point is that the thyroid being fine is something that I've had issue with sort of how we interpret the thyroid. I feel like everybody has a thyroid level and number that is appropriate for them. And what I feel like we're doing is a lot of times like lumping everybody into one big category. So for many women, they come in and they're like, my thyroid's fine. I had it tested. What do you mean? And, and I'm looking at it being like, wait, it's actually sluggish. I really like my TSH to be between 1 and 2. There's some women that need it even more aggressively corrected than that. I'll look at the T4s, the T3s, the RT3s, the antibodies, and that is the issue, And then there's some patients for which you sit and you talk to them, and this area of hypothalamic inflammation, right, which, continues to interest me and fascinate me, but there's actually inflammation in the areas that work to signal your hormones, because the hormones, remember, are on a feedback loop, right? They start in the brain, they work at the end organs. And when there is chronic stress or trauma or, things that have happened to women or even environmental toxicity.
What about endometriosis?
Endometriosis,
source of inflammation.
Exactly. Then you have inflammation through the entire axis. And so if you're not dealing with the inflammation, sometimes that's the block, right? So it's helping people uncover what the block is and then making that decision. Is this going to be best served with medication, with emotional work, with, what surgery, like what is it that needs addressing at this given moment?
So if I'm thinking about patients that are pursuing fertility, inflammation, I think, is finally getting the recognition that it needs.
Yes.
And this would be a silver lining of COVID.
True.
I mean, we have
to. Yeah, you're right.
Because that really put inflammation on the map. But unfortunately, there were a lot of patients who miscarried in these past 3 years of post-pandemic. And we don't really quite understand yet what happened. But I'm sure inflammation was
a big part of it.
So how would you address inflammation with respect to like endometriosis and inflammation in the ovaries and the lining of the uterus and the sperm, like on the reproductive level?
Inflammation, first of all, you can measure inflammation. We can measure it.
Please tell us how.
We can measure it. We can get a sense of what's going on. And there are many different ways to do that. First of all, there's blood work. So you can look at a CRP, you can look at a SED rate or a ESR. You can look at markers like ANAs.
How about antibodies?
Antibodies as well, IgG levels. There are many, C4a, TGF beta. There are many different ways to measure and assess inflammation. Those, though, will assess more systemic inflammation, right? Not necessarily limited to the reproductive area. So I think that's the first step, is do the blood work and understand what your body burden of inflammation is for sure. I think the next is for anybody in the fertility space, and this might be a bit controversial, but I do believe it. I think doing imaging, both pelvic ultrasound to look at the thickness of your endometrial lining and rule out things like fibroids or ovarian cysts or any of those type of things, is really important. But in addition to that, doing thermograms. We actually do thermograms in our practice, and you can do them limited to the abdominal and the pelvic space. And I get a lot of grief when I talk about them, and I don't know why. We're not using them to diagnose, but we're using them to get a visual map of inflammation. So that's one way to know that there's a ton of inflammation, sort of corralled in that pelvic area.
Right,
and it's an incredible tool to use. And so these are two tools that we use in practice. Now, if we bring in Eastern medicine and older systems of medicine, they had their tools too, looking at the tongue, looking at pulse, getting a sense of what's going on there. So when we're trying to educate or even trying to make decisions, of where do we begin? And I've done that all day today here, like talking to patients. Where do you begin? Because there's inflammation, there's hormone balancing, there's your gut, there's your liver, there's nutrients. There are all these ideas, right? There is your emotional bandwidth and emotional well-being, right? All of them are involved in this concept of inflammation. So if we're going to start and we decide that based on lab work and imaging and your history and everything else, if inflammation is really where we need to begin, then that is doing a lot of gut work to bring the inflammatory load down. And then it is using things like, diet cleanup, adding in things like turmeric, omega-3 fats, so many different great anti-inflammatories that are out there to bring those numbers down. And then we track them and we trend them. And sometimes we get even more aggressive. Honestly, we'll move on from that and we'll do things like glutathione, which is an antioxidant, brings inflammation down. And there are ways to do that both just orally or via IV that makes a huge difference for our patients. And then we've even used low-dose naltrexone in an attempt to bring the inflammation down as well.
Fascinating.
Yeah.
I'm going to throw something at you that I mentioned to some of my colleagues here in the fertility space. And I have been using, following the pandemic, Serapeptase.
Yeah.
And I don't understand fully the mechanism. It was something I knew of from having endometriosis, and I know that's good for reducing adhesions. And I sort of got this intuitive hit that to give it to my patients who are suspected endo or silent endo, or they've been treated for endo, but clearly they have that phlegm, heat, damp, blood stasis, cold intermingling, hot mess of a pelvis. If I gave them just a low dose of Serapeptase and put it with a little bit of vitamin K2, the miscarriages stopped.
Interesting.
And I think it's because it moved some of the microclots out of the small blood vessels of the lining and surrounding the ovaries and the testes. And then the K2 helped to remove any potential plaques or calcifications in there, and they were already taking fish oil. So then the blood was thinner.
Yep.
And I think it was a magic.
Ooh, I'm gonna have to use that on
Yeah.
patients.
So do you use Serapeptase?
I haven't been using Serapeptase. That's not one I've been using.
I think, but you perked up when I mentioned it. Is it one that you're familiar with?
It is one I'm familiar with, and I've been reading a lot about it, but I haven't used it the way you're using it in the fertility setting.
But it's got some anti-inflammatory properties.
Definitely.
And it seems to be good at breaking down adhesions. It was supposed to be like used in the lungs, but then it's being used on endometriosis. So I knew that it was going to target those structures, and it helped me get over pain. And some of my endo patients, they have benefited from it. So I figured, hey, instead of having a 4th or 5th loss, why don't we try it?
Yeah. And it's been successful. That's incredible.
Yep. Knock on wood.
Yeah. That's incredible.
Yeah. I mean, these are how we figure these things out. And this is the nature of integrative medicine. I loved that you said the emotional piece is a part of inflammation. I think knowing that you are a Western MD at the core, and to honor the emotions shows the Eastern medicine, your personal journey. And that is so understated as a factor in these hormone problems and fertility issues. I think it's because it's seemingly too hard to wrangle those emotions.
Right.
But what I learned with the SEED program and this observing them cyclically is women are actually very predictable with their emotions and their mindsets based on how much estrogen, how much progesterone.
Happy dark.
Exactly. And flowing through, like feeling full of potential, feeling vulnerable, feeling out of balance.
Totally. I think I experienced that personally. I know my patients experience that as well too. And I think I've got to credit older systems, Chinese medicine and Ayurvedic medicine, for understanding the emotional and the energetic body. I wouldn't have understood it, but I think I've told you, like, we do all the scanning. We've even brought it here, right? We do like vibrational energy scans to really read the emotional body more than for any other reason. And we do the AccuGraph to get like sort of that more data-driven, meridian analysis, because not every practitioner that works with me has done a deep, deep dive into Chinese medicine. But at least here now, we can show them, and we can actually show the patient where these worlds collide, right? So you have the spleen meridian. Well, what's the emotion with the spleen worry,
overthinking.
Right? Overthinking and worry. So we can tell the patient that, and they're like, they're not going to get it all. They don't get everything the first go round. But we plant that seed of like, hey, this stuff is interconnected. And then even on our vibrational scans, you'll see things like, there's a category for inflammation. There's a category for hormones. There's a category for different things. Sometimes under inflammation, the first thing showing up is grief or trauma.
Right.
Or under hormones, the first thing showing up is anger. So then we are able to open the door to that conversation that, while this is physical, it is being driven by these emotional patterns. And sometimes it's not. Sometimes it's the other way around, right? Like something's really wrong, like something physically is off. And that's where we have to focus to get the emotions where they need to be.
That's causing them to be so upset.
Right.
Right. Endometriosis, I'm going back to that because that pelvic inflammation flaring up, causing the nervous system to be upregulated. And then the upregulation causing her to eat poorly.
Right. I think my daughter's dealing with this right now. Honestly, it's in our family, PCOS and endometriosis. And, when you were saying Serapeptase, I was like, I might start her on that. But yes, there is this, it's an inflammatory disease. And I think it's the root of even the IC and the interstitial cystitis and all of that. SIBO, like all these different things that we deal with. And it needs a gentle approach, right? It doesn't need a sledgehammer approach. It needs a really gentle approach of healing the gut and moving the energy. I'd be curious how you deal with many of your endo patients.
Well, a holistic approach to healing endo. That's exactly what you're describing. It's it's not just take out the endo.
Right.
We have to address the emotions. We have to address the gut. So I'm talking to Dr. Larry Orbach, endometriosis excision surgeon, and he takes a holistic approach.
Oh,
so
amazing.
That's another episode.
Yeah, it's amazing.
But it's really good. We're seeing so much better outcomes when we do treat holistic. So there is hope. But here's another wild thought.
Yes.
I'm going to run this by Larry Orbach, but the microplastics. I recently had endometriosis surgery for a third time.
Oh, no.
And he described an apron when he went in. I had all of it removed, but he found an apron of like gauze. And I was thinking, I wonder if that is microplastics leaching through the intestine and forming a little sheath. And he was able to see it in there, because the rest of the endo had already been removed 17 years prior. So I'm going to talk to him about that, but I want to talk to you about microplastics and endocrine disruptors.
Yes. So, endocrine disruptors we're very concerned about. I do feel like they're often that and many of our environmental concerns are at the root of a lot of the hormone imbalances we're seeing. I think many of them are also obesogens, right? So they actually drive obesity and weight gain and things like that. And we're seeing those really impact children younger and younger and younger. And again, we both believe in this foundational approach to hormone balance where everything is building upon itself. You don't just arrive at a point and be like, oh my gosh, this happened to me, right? So the concern with endocrine disruptors, which are in our food, our body care, our clothing,
products,
our home products, our carpets, our paint, all these different places, is that the liver, back to the liver, can't do the job it's supposed to do. We have a boggy liver, we have poor detox pathways, and we have basically compounds and substances that mimic hormones floating around in our body. And so it's triggering everything from early puberty in our children, right? Girls going into puberty much earlier, to the androgenization of girls, meaning they're having more and more of sort of these male derivative hormones, the high DHT, the high, DHEAS, testosterone, all of those, to the estrogenization of our boys, where they're having more stored estrogen. So it's very much disrupting the hormone axis, or this feedback loop that we talk about.
And causing weight gain from the hyperestrogenization.
Definitely.
Girls.
Definitely.
And perimenopausal women. So what do we do about that?
Everyone asks me that question. Like, okay, is it all gloom and doom? Do we go high? Do we live in a bubble? I think it begins with owning your personal chemistry. I think that's the first part. What can you do on a day-to-day basis to clean your liver, have a healthy gut, have a healthy liver? And a lot of that goes back to food choices and some of the things you're taking, right? So if you can increase your own natural sources of something like glutathione by adding in lots of greens or a green smoothie every single day, that's going to help in this process of removing chemicals from the body. I think there are supplements that help with that as well. But then when it comes to your life, pick an area to focus on to really reduce that load. Don't get overwhelmed that you're doing everything wrong. I see so many people, like, especially young women, I think, with new families, really just stressing out about like, oh my God, there's a high toxic load. I'm ruining my child's life forever. I wouldn't take that approach. I'd be like, I'm going to focus on food. I'm going to try to make sure we have the cleanest, healthiest food in the family. And that's going to be my value and my priority. And then from there, sometimes you'll move on to like, okay, well, let's like really look at our household products. Let's go there next. Or your own personal makeup or things like that. So I think it's many of these things are journeys, and you don't have to accomplish them all at one time, but you can take a very stepwise approach.
Right. In the context of baby making, it can really be taken too far.
Oh, yes.
The clean out all of the plastics and go to glass casserole dishes and things. But then I think, well, but did you touch the steering wheel in your car?
Yeah.
Did you put on, did you squeeze a tube of toothpaste and brush your teeth? There are so many plastics. We're touching them all the time. So it can really create neuroses and a lot of panic, thinking that they need to clear all of that. So it's that 80-20.
80-20.
Do your best.
Do your best. Yeah.
And try to not let that upregulate your system.
Absolutely.
That quest.
It's too much. I mean, I literally have patients crying in the room because it's so overwhelming and they don't know where to begin.
Mm-hmm.
But I say pick a category. Really pick your category and focus there. And that between picking your category and owning your personal health and your toxic load, I think you're going to make huge strides.
Mm-hmm. I agree. I'm so glad that I got this chance to talk to you.
Thank you.
I'm curious, any thoughts you would have specific to baby making, fertility, maybe something for women and something for the men?
Well, I think you and I are probably in alignment on this one, and I'm sure you talk about it all the time. I think in today's environment, with the stress levels and everything else going on, I'm concerned about pediatric health. I started as a pediatrician, and I think one of the things I would urge baby makers to do, both male and female, is to really invest in preconception evaluations and physicals. And by that, I mean getting into these functional medicine concepts of where is your nutrition, your inflammation, your gut health, your toxic load. I think the more that both partners can really understand that, I think we're going to make healthier embryos, have healthier kids, because our children today are coming in with chemicals and endocrine disruptors floating around, from day one. So they're kind of set up for having many of these issues, even before they have a chance to really dive in and make changes. So I think the more we can do on the preconception front, the better. I would say the second is, maybe this one, I think this is for both too. I mean, really start to reduce the consumption of alcohol. I think that we don't talk about it enough, but it really does impact the liver. It really does lead to overall estrogenization, and it increases inflammation and yeast in the gut. So if both partners can really make a conscious effort, to reduce alcohol prior to conception, I would say at least 6 months or so prior to conception, then I think, first of all, pregnancy goes better. I think that the mental health of the other partner is much better, and then the baby's healthier as well.
Yeah. Well, you just, of course, opened up that question. What about coffee?
Oh my goodness. Coffee, poor coffee, right? It gets such a bad rap. I mean, 4 to 6 ounces of organic, high quality coffee is not bad, right? It may spike the blood sugar a little bit, but if that's all you're having, that's not bad. It's the 3 to 4 cups a day. It's the
sugary frappy things.
Dressing the coffee up and kind of this frappuccino, cappuccino, like all the different versions of it, right? So that's actually, I think, what is more of the issue than a single serving of good quality coffee.
Right. Agreed. And then there's when can I have my coffee? Do I have it first thing in the morning, or should I have it in the afternoon when my cortisol is dropping?
I think we're overthinking it. I think everybody likes their morning coffee, right? Let's not take that away. But
that's what I say too.
I know, have your morning coffee. And if you want to blunt the cortisol spike, add something like MCT oil to it. That's going to help a little bit. It's going to keep the blood sugar a little bit more stable. Or just try to eat within 30 minutes to an hour of drinking your coffee. So that blood sugar spike, you're managing ultimately with some protein or healthy fats or things like that to bring it back down.
Mm-hmm. Can we talk about diet for a few minutes?
Sure.
But before we go to diet and we're talking about the bad things, where do you stand on pot, marijuana use, specific to fertility?
I'll be honest, I don't have a ton of experience with pot and fertility. I'm generally against it.
They probably know if they're going to see you,
right?
They're not going to be having their edibles and smoking.
No, I'm generally not really. I like pot for anxiety.
Mm-hmm.
I like it for sleep. I like it for hot flashes and night sweats and those type of sort of menopausal symptoms. I feel like they really have a great place there. I don't think we know enough about pot. And I think we're a little too liberal with it. And we don't understand the long-term impacts on hormones and on cognitive health, both.
Mm-hmm. Agreed. Yeah. Great answer.
Good. I didn't know where you were on pot either.
I just, in Chinese medicine, it's warm and drying and it scatters the heart qi and it creates stomach heat. So that's going to make them crave more sugar and in the long run be a little more anxious after that immediate relaxation.
Right.
And they're already so anxious. I don't want them doing something that's going to scatter the
energy.
egg reserve that they have. And then the heat and inflammation that's created for the testicles, and then the blood stasis and the varicocele. So I've been asking that question, and it's been coming up in the other episodes.
So what are people saying? Where's the consensus?
They don't like it. The doctors that I've interviewed, they're not liking
about that.
I think here in California, it's legalized. It's just too easy to get.
Do you think it's estrogenizing men as well?
I do.
I do too. Yeah.
I think it does something to something with the fat molecule, and we know that's related to estrogen. So I don't know. Like, my domain isn't organic chemistry and biochemistry. I need to stay in my own lane.
Well, I haven't studied it, honestly, but this is my observation. And this is sort of like when I look at data, and then I look at those who smoke. I mean, no studies, right? No formal studies. But when I'm clinically observing these things and then looking at lab work, that's my observation.
Mm-hmm. Thanks. So let's go talk about diet for a little bit. Your 5 favorite foods for reducing inflammation.
Ooh, okay. I love these. 5 favorite foods for reducing inflammation. I love avocados for all the healthy fats, and even the medium chain fats, right, which stabilize the gut. I love, and this might be controversial, I love a good high quality yogurt, because we have good probiotics. My mom used to make yogurt, right?
I'm a big raw dairy pusher.
Right. If we've got a good starter and we're making it, it's actually probiotic rich. It's like really great for the gut. I love the leafy greens, because we're getting a ton of glutathione that way, and we're getting a lot of vitamin A and vitamin C, all of which are eggs and sperm and everybody needs. The omega-3 foods, I think we've got to include. They really do help to reduce inflammation. So this is going to be things like your fatty fishes, like salmon, chia seeds, flax seeds. Those are some of my favorites as well. What else would I include on that list? And then I kind of go into the spice area. I mean, I love turmeric, right? Using it for cooking, using it as an anti-inflammatory. That's one of my favorites as well.
Those are good ones.
Yeah.
Yeah, I love arugula.
Ooh, that's a good one. Yeah.
My kids, they if they have a friend come over for dinner and the friend asks, "What are we having?" Kira says, "I don't know, but I can tell you there will be arugula."
Oh
on the
my
plate.
gosh, that's awesome.
I'm just constantly trying to detox the liver, because they want Starbucks.
Oh, I've done sneaky things like, oh, it's pizza night, but it's arugula's pizza night. So anyhow, they have no clue.
To get tricky with those kids. We could go on and on, but unfortunately we cannot.
We can do it again sometime. How's that?
Yes. So where can patients find you if you're in Atlanta, but you are here in LA sometimes? Yes. So how can patients reach you?
Well, I am so thrilled to be opening up here in LA with you. So we are here with you in your office in the LA area. We are in Atlanta, and we're opening in New York too. So we have more physical availability in terms of people coming into the office to see us. And then we run a virtual platform as well. So it's Center Spring MD. You can learn more about the clinic definitely there. And then I'm on Instagram, YouTube. I have a podcast, Superwoman Wellness.
Love it.
So just join me wherever you feel inclined. Join us on this journey of really trying to really get your health and the health of your family in the right place.
Thanks, Dr. Taz.
Thank you.